Bronchiectasis is a condition of permanent dilatation of bronchi. Now let's find out what happens in these patients which results into permanent dilatations of bronchi. What's the pathogenesis behind it? So in this, there is chronic infection or inflammation of the respiratory tract. And now what happens is this chronic infection damages the muscular as well as elastic component of the bronchi, and once these bronchial walls are damaged, they result into dilatation, and there would be impaired mucociliary clearance of mucus resulting into retention of secretions, and in those secretions repeated infections would be present. So in a patient of bronchiectasis, you will see repeated respiratory tract infections. So it's a vicious cycle. Like first of all, infection would result into damage to the bronchial wall would get dilated, and this dilated bronchial wall would result into impaired mucociliary clearance, and that again would lead to a respiratory infection. So it goes on. It starts with an infection, and it makes the patient more prone for other respiratory infections. So it goes on. That's why it's a vicious cycle. What are the causes behind bronchiectasis? As discussed, most common cause is post-infectious. It is also seen in tuberculosis and cystic fibrosis patient, along with primary ciliary dyskinesia, which is called as Cartagena syndrome. What actually is happening in cystic fibrosis and Cartagena syndrome is there is buildup of mucus in the respiratory tract, and this mucus, which is adherent to the respiratory tract, serve as the breeding ground for bacteria. So there would be repeated infections, and infection will damage bronchial wall, dilatation goes on and on. Then ABPA, allergic bronchopulmonary aspergillosis. Aspergillus is a fungi which commonly affects patient of cystic fibrosis and asthmatic patients. There would be high IgE levels and eosinophilia. We'll discuss that in other videos. So now let's discuss about the clinical features in the patients of bronchiectasis. Since there is chronic infection, the setting of chronic respiratory infection, there is dilatation of bronchi. So there would be chronic cough along with abundant purulent sputum production. There would be recurrent chest infections along with breathlessness and finger clubbing. So finger clubbing is the physical finding you can find in the patients of bronchiectasis. Now let's compare this sputum production as seen in COPD and the patients of bronchiectasis. So we can easily see, as the definition says, bronchiectasis is permanent dilatation of bronchi, whereas in COPD, which is chronic obstructive pulmonary disorder, there you will see narrowing of bronchioles. In bronchiectasis, there is abundant purulent sputum production, whereas in COPD, it is only scanty sputum or moderate amount of sputum. So if the amount of sputum is compared between both the conditions, bronchiectasis always wins because there is more abundant amount of sputum production. There would be recurrent infections in bronchiectasis, whereas there is minimal infections in COPD. Clubbing is a general finding which you will be seeing in patients of bronchiectasis, which is rarely seen in COPD.